We'll ask for approval of the minutes.
I will move the minutes.
Commissioner Nissen moves the minutes. Do I hear a second?
I'll second it.
Commissioner Anderson seconds. Is there any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. I want to make a comment that it seems it's refreshing and seems odd to have such a full dais here today, and I'm glad everybody's back and glad we're moving forward. We're only going to charge $18 for attending if you've got a vaccination, but if you haven't been vaccinated, it's costing $1,000. There's a concert in Florida, that's what they're doing.
Oh, really?
All right, I'm sorry for digressing. We have some routine contracts and agreements to renew, so Leah?
I was going to mention the same thing. It's nice to see everybody.
Sorry.
See their faces.
Didn't mean to
and
steal your thunder.
Last time I was here, we didn't see each other's faces, so. I'm going to present the fraud contract for 20, it's for 22 and 23. Candia County Health and Human Services contracts with the Department of Human Services and the Office of the Inspector General for our fraud contract. As part of that contract, which includes reimbursing the salary of our fraud prevention specialist, we are held to performance measures and benchmarks that must be met. Some statistics comparing Candia County to the state of Minnesota benchmark for the fiscal year 2019 to 2020. Our cases in Candia County, we average about 37 a month, and the state benchmark is 25 to 30 per month. The average days it took for Candia County to complete a case is 3 days, and the average days required is 15 days or less, so we're right in line. Cost to benefit ratio is $7.89. The state average is $7. And the required cost benefit ratio is 3. Cost savings for a total of $732,952. And our referrals have increased in 2020 substantially, and due to part is the unemployment benefits that were in addition to the normal benefits that people were getting during the pandemic. So we had to have our fraud investigator have a referral done, and then she checked the benefits to see if people were getting those benefits, to see if they would be counted for our programs or not. So we submit referrals for these cases, and the numbers for 2020 was 625 fraud referrals. The state benchmark is 360 referrals, so we are above the state average. A savings of $192,200. This means in Candia County saved the state of Minnesota $192,000 by completing these referrals and preventing public assistance fraud that we had we not had a fraud investigator, we would not have been able to save that amount. Our fraud prevention specialist is trained to use tools in the investigations that help reduce or prevent fraud for our programs. As part of the contract, Candia County provides fraud training for eligibility workers, both in our county and in the region on a yearly basis. The programs that are investigated are the MFIP and DWP programs, they're cash assistance programs, the SNAP program, the Child Care Assistance Program, MSA, which is Minnesota Supplemental Aid, and General Assistance, and the healthcare cases, which are referred on a case-by-case basis. Some situations investigated are false applications, which may include income sources, absent parent residing in the home, and forged or false statements. We are glad to be able to partner with the Department of Human Services and the Office of the Inspector General's Office to continue to provide fraud prevention work for our programs, again, for the next 2 years for this contract. And in closing, I would like to share, it is everyone's responsibility to report potential fraud. For anyone that suspects fraud, for recipients of cash, child care, food assistance, healthcare, child care providers, please call the number 1-800-627-9977. Somebody have any questions?
Is there a numeric number that's attached to this, or, because I looked through the contract and
I'm sorry, yes, it's $95,000 is for the contract for our fraud prevention investigations and the benefits of that.
So,
Mr. Chair,
yes, sir.
my question, thank you. What's the difference from last year's contract since we hadn't,
Well, it's a 2-year contract, and
or the last
yeah,
year?
I guess I'm not positive on how much, I know they've increased substantially in the last 2 years. I don't have a number on that for you today.
Okay.
So the chair entertain a motion, you're looking, seeking approval of going forward with this contract.
Okay,
So move.
I'll second that.
Commissioner Gardner moves, Commissioner Nischen seconds. Any questions or comments? I would just say that it looks like one hell of a good return on our investment when you look at $7.89
yes.
versus $3. But I got a couple of questions. First of all, where do the referrals come from? And why is there a significant disparity between Candia County and the state on average? And I'm sure
Sure.
that if you compare
Sure.
other counties, you're going to see different
In
numbers. But
the last year, we had a lot of referrals from eligibility workers. So as we get applications, if we have questions on that, then we do the referral. And it could be, possibly income that wasn't reported or household composition. So from within a lot, but we do get from the fraud hotline also. People in the public can make those referrals.
but mostly within our own department, our own staff.
And if I can just add one thing, not every county has this contract, so that's something else too. I know that not every county does. So our staff are trained to make reports internally across our agency to our fraud investigator, but that doesn't happen in all counties because they don't have this position.
So it's not necessarily a reflection that we got more dishonest people or crooked
No,
people
I
here in
don't believe
Candia
so.
County. All right.
Mr. Chairman, then
Yes,
what,
sir.
what was that phone number again?
It is
1-800.
1-800-627-9977.
Okay, thank you.
Welcome.
All right, Mr. Gardner.
Thank you, Mr. Chair. Briefly, was there any sort of impact that the pandemic had that may have driven some of these numbers?
Well, definitely, I mean, we did have the referrals because of the unemployment, because in order to check on that benefit, if they're getting that benefit or not, the unemployment benefit, a referral needed to be done. So it definitely was an increase.
So it was the increased benefit that made some folks
Right.
ineligible,
Right.
and not just a regular unemployment benefit?
Right, because some of the extra benefits that they received weren't counted. For some programs it was, and some programs it isn't. So it was
Okay.
something we needed.
And sometimes an applicant simply may not know that.
Right,
yes.
Right, and we do make it a requirement if they possibly would be eligible that they apply for those benefits.
Okay, so to Roger's point, then, it's not that we have more people trying to game the system. It's just sometimes people don't know what they don't know.
Right,
All right, outstanding. Thank you.
welcome.
All right, so we have a motion on the floor to accept the contract, enter into the contract, I should say, in a second. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Proceed with the SNAP, Supplemental Nutrition Assistance
They need
Program.
to sign it.
We can at the end.
Okay. So the second thing I have for you today is we received additional funding for the SNAP program. The state of Minnesota provided an additional $25,000 for us to contract with the Wilmer Career Force Center to provide services to our food support customers. They are able to assist clients with counseling, job search, job placement, and other direct program services. They also are able to provide transportation, gas cards or bus passes, and in some instances, car repairs, oil changes, or license costs. Other employment-related expenses are clothing, tools, and other items that are required for their job. In the last year, during the COVID peacetime emergency time, we have seen a substantial increase in our SNAP clients also. In March of 2020, a year ago, our SNAP caseload was 1,878. As at the end of March of 2021, our caseload was 2,176. So it's an increase of almost 300 cases in a given month. Not all food support clients are referred for these services. If they're have children or have disabilities, some reason that they aren't able to work, we don't make those referrals to the career force for these services. The clients we refer for this money, for this contract, are usually the able-bodied adult workers without dependents. With the additional funding, that career force will be able to help many more people. So the last contract, when we talked, was a year ago, and we had, the original amount was $7,478. So you can see we got quite a substantial increase for those services.
All right, so we're requesting another, entering into another contract. I'd entertain a motion to do so.
I so move.
Commissioner Berg moves. Do I hear a second?
I'll second it.
Commissioner Anderson seconds. Any questions or comments or discussion?
I guess I have.
Commissioner Nissen?
The SNAP program is administered through the Health and Human Services. But now this money is going to the workforce
Correct.
group? So, okay. So they help folks that haven't already been seen in your area?
Right, we make those referrals,
Okay,
and then they meet with workforce, and sometimes they make a employment plan with them to get on the track where they need to be, what assistance they might need to further their opportunities.
okay.
All right. Any other questions? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you very much, Leah.
Yeah, thank you. I have for Corky to sign here.
Sign it off.
While she does that, Tammy Jo, you want to make your way up to the, you're,
I'm going to turn it over to Pam.
okay, very good.
Morning.
Welcome.
Morning.
I'm Pam Erickson. I'm Deputy Director of Candia County Community Corrections. And our director, Tammy Jo, has asked me to bring someone in to share a success story on probation with you. And so I would like to introduce Myra Fernandez. She was on probation with me off and on for several years. She is no longer on supervision now and has been off for about a year. And she would like to share her journey with you.
Welcome. And would you restate your name for the record and for those that may be watching?
Sure. My name is Myra Fernandez. I am a former client of the Candia Ohio County Corrections Department here in Candia Ohio. It's an honor to be here with you guys, and thank you guys for having me here. I'm here today to share with you guys a little bit about my experience while being on probation. And so I want to start, I'm going to read it because it's probably
Sure.
better than.
That's just fine.
So when I first started working with probation, with a probation officer, the monthly appointments were treacherous. I didn't know if I would walk out in handcuffs. I didn't know how to live a honorable and crime-free life. And so so I'll start with letting you guys know a little bit about myself. So I'm a first-generation Mexican-American. I was born and raised in California. I'm the fifth of 6 kids. And I was raised by a single mother who also struggled with drug addiction. Growing up was hard in California. We never had much of anything, and so my mom moved us here to Minnesota, Wilmer, Minnesota in 2001 to try to give us a different life. It was very different here, and that's when I first started having encounters with police officers and probation. let's see. So when I moved here in 2001, I quickly became involved with the father of my children. I was 13 at the time and got married really young at 13. We didn't live a very honest life, and life was hard. And thankfully, in 2009, our consequences had caught up with us, and we had both went to jail. Prior to the 2009 drug bust that landed me in jail, I was abusing methamphetamine, and so I was on probation and kept going to jail, being held accountable for not being able to stay clean. So that was hard, being on probation and not being able to follow through. And so in 2008, or in 2009, I went to jail for about 5 months and came out, and Pam Erickson was my probation officer. And they had offered a lot of programs to me, like the cognitive skills programs and stuff like that, that were very helpful to me. I think what was really helpful as well was that I was on my own for the first time. My ex-husband went to prison for his charge, and then I got out, and in that time I learned so much, and I grew up so much. I took care of the kids on my own. I waited for him to come home from prison, and I started working at a laundry company here in Wilmer, and moved up to being an office manager in that same company. And while I was working there, I was doing a lot, and I knew I could get paid more, and they said no. So I went back to school and got a certificate that said my name and that they'd have to pay me more if they wanted me to do the job. And they accepted. So that was a lot of success. Those years of being sober and working with Pam, going to meet with her monthly was really nice, because I got to have a different perspective, a healthy perspective, because most of the people in my life were not healthy at that time. And so that was nice to have her. I would joke that my probation fee was I think it's $250 a year, but that was my therapy fee, because it would cost so much more if I went to talk to a real therapist. So yeah, I went back to school. Ex-husband went back to school. We had some success. However, in 2014, we got divorced, and things were hard. It was a shock. I lost my best friend at that time, and I wound up in another relapse that lasted about 11 months. During that relapse, I lost the job that I was working for. My children were removed from my care. I lost my apartment. I lost it all. It was really hard. At that time, I also worked with the drug court program, which was not a big success for me. I'm pretty sure that I had a lot to do with that as well. But I decided to withdraw from the program, and I had made up my mind that I was going to go to prison. But probation and other people believed in me, and they suggested at sentencing that I complete my treatment program and follow our recommendations. And I'm so glad that I did, because I went to Project Turnabout for 90 days and then went to a halfway house in Rochester, and that's where I started a career in retail and had held several lead roles. Retail is tough with 2 children, so I decided to step out of retail and work in production at Jenny O Turkey Store, and that was hard too. But I showed up day after day, and today I'm an administrative assistant of the Vice President of Human Resource. It's a really nice job. This is going to be my 3rd year in that role, and I think I've got this role mastered. So I look forward to growing in the company. In October of last year, I hit another relapse. I was not on probation, but I still reached out to Pam. And it was a relapse that lasted 2 months. And it was tough. It was scary. I didn't know if I was going to make it out of that fast. And there were times that I wanted to give up, but Pam, even though she's not my agent anymore, continued to check up on me. And it was different because I didn't know how to get help without being in trouble. And so Pam kept asking the right questions, like, what else can you do? And I'm like, I tried everything. You know, I've tried to change the circumstances around me. And in recovery, we know that you can't change the circumstances outside if you don't change the inside. And so I had to work up to surrendering. And so I did. I surrendered. I went to the doctor. Well, I tried calling the cops on myself and asking if I can go to jail, but it doesn't work like that. Just no. And so I went to the doctor and I asked that they give me an emergency medical hold at detox, because detox, you can go in, and if you're voluntarily, you can walk. If you go in there voluntarily, you can walk right out. But I needed more help and accountability, and so that was helpful. I went to detox for 5 days and then had to figure out insurance and where I could go next. And then I went to Teen Challenge in the cities, which is an amazing program. And so I was there for the short-term program and graduated, came out, did the outpatient, and I've been sober for 124 days today. And I'm so glad that I was courageous enough to take the time to do what I needed to do to get myself better, because I just, at that time, I knew that wherever I was going, that part of my life could not come with me. There's a world out there, and it's tough, and I don't want to be a part of it. And so I choose different. I choose to obey the law and keep working hard. And so life is going really good for me right now. I'm in a new relationship and looking towards getting married. I will be putting I'm going to be putting an offer on my first home today at 11. So that's really exciting. And so I, hear that human resources here and whatnot. But so now that I work and I can provide for the kids and stuff, it's harder to get help. Me and another gal had the similar experience. She got out, she didn't work, and all her bills got paid. And so thankfully I was able to pull through, especially with the extra grants and stuff from COVID, but that seems not fair. And $5,000 out of pocket later. Thank God I'm sober and I can be here today to share with you guys that the program, the Community Corrections, is doing a good job with holding us accountable. There are things that just are not okay in this community, and that's because of the police, drug task force, community correction. So keep up the fight. We need the resources, we need the programs. And for some of us, it takes a lot of time. And but there is hope, so don't give up on us. With that, I'm done.
Well, thank you very much for coming in. It takes a lot of courage to tell that story and to keep starting over, and so appreciate it and wish you the best of luck. Does anybody else have any comments?
Yes.
Mr. Gardner?
Thank you, Mr. Chair. Myra, you started this by saying that you were honored to be in front of us today. I'm afraid you have that wrong. The honor is entirely ours. You show up, you put in the work, and you don't give up before the miracle happens. And for that, I commend you, and we all commend you.
Thank you.
I just want to add, Roger and I can both agree that retail is tough. And I gave it up after 30 years of selling shoes and went into the insurance business. But I'm glad that are you still at Genio then? Or?
Yeah.
Awesome. I'm glad that you were able to keep that and to reach that goal in the first place. There's a lot of great jobs out there at the turkey store, and we're happy to have those folks and you in the community, and congratulations on your defeating your issues, because that is not easy. And I had a hell of a time quitting smoking. I can imagine what you went through. So keep it up.
Thank you.
Thank you.
Mr.
Commissioner
Chair,
Berg?
yeah, I just want to pile on more again, what courage has took, but it's not only the courage that you took to do this, but I'm just keep thinking that it tells us how the system really does work, and often we hear the system doesn't work, and there's really good parts of it, and I'm so glad to hear your story. But your story is also going to help other people, and so you're not just helping yourself, and I really appreciate this very much. Thank you for sharing.
Thank you.
Thank you. So one of the questions that I have sort of rhetorically is, you made the comment about you didn't know how to get help when you weren't in trouble, and I'm thinking, that's really a problem, because you needed that help and you weren't in sideways with the law, or didn't have a Pam that, is looking in on you all the time. I mean, Pam did, but she wasn't obligated due to her job. So it's kind of an interesting dilemma, actually, when they need that support, where do they get it? But your testimony here is not only to the hard work that you've done and continue to do, but the whole staff and Tammy Jo's department and the successes. I know they don't all turn out this way, but even a few make a big difference to all of us. So thank you again for coming in,
Absolutely. Thank you.
and best of luck.
Yes, thank you.
Mr. Chair, may I
Yes.
comment? Yeah, one other comment is, I'm really glad to hear as a board, too, the flexibility that the departments and the agency heads and staff have to be able to continue to follow up on some clients, instead of saying, well, we're not being reimbursed for this, we can't do this. And that's very good.
Thank you. So Jenny is going to visit with us about some changes that have taken place with our contract with Blue Cross and Blue Shield. I think Commissioner Gardner, or Commissioner Anderson and Commissioner Gardner were not on the board at the time we entered into a contract with Blue Cross and Blue Shield to take care of, to deal with some of the work with MNsure patients. And so we entered into that contract. Some things have changed now, and Jenny's going to go through that and probably have a recommendation for us. Welcome.
Yes, thank you. Thank you. Jenny Lippert, Health and Human Services Director. So I want to give you an overview of our home and community-based service area. This area is made up of our Min Choices team, our Waivered Services team, and then we also have one MCO contract with Blue Cross Blue Shield to provide care coordination. Specifically in the Blue Cross Blue Shield area, there are two different teams, some staff that do community care coordination for those over 65, and then some staff that do this work in our nursing homes in our area. I want to point out that some of these services are mandated and others are not mandated. So we have our Min Choices and Waivered Services that are mandated and in statute that we as the county must portray and do this work at the county level. The MCO contract with Blue Cross Blue Shield is not something that we are mandated to do. We opted into this several years ago. Some counties do opt into these MCO contracts and do care coordination, and others don't. So a little bit of background, we at the county used to have 3 MCO contracts. We had a contract with UCare, a contract with Medica, and then now that Blue Cross Blue Shield contract. Both UCare and Medica had become unviable to locally do that work at the county level, so those contracts had been terminated. But really, we opted into this Blue Cross Blue Shield contract at a time when we had a need for staff. There were no county costs involved to do this work locally at the county level. The contract has been reviewed several times. There was actually a county work session held on this back in 2018. In my time, I've reviewed this extensively during different phases with the two supervisors, both Kathy Nelson and Tammy Goldenstein. And I think there's just always opportunities to look at it, but now I want to bring forward some concerns for the continuation of this contract. So in this area, we have 5 staff. We currently have 1 vacancy that do community care coordination, and then we have 1 and about a half-time staff that does this work in the nursing homes. Again, these staff are working on behalf of Blue Cross Blue Shield, so they are not representing us as the county. It's not that the county board has leverage of this contract. Again, we are contracting with Blue Cross Blue Shield, so these staff are doing the work on behalf of them. Care coordination, again, just so you guys are familiar, these staff are doing it for individuals who are over the age of 65 and on the Medicare, Medicaid program through Blue Plus. So these staff work with the subscribers on Blue Plus and make sure that, do they need any assistance with doctor visits or medication, or if they're in a nursing home, are they getting the care? They're kind of working as that liaison staff. Some of the current factors and data that I wanted to point out and why we're bringing this forward to you today to take a look at it is there's a lot of changes coming down from DHS in the state that would potentially have an impact of the overall home and community-based service area. So not just this Blue Cross Blue Shield contract, but our waivered services and our Min Choices area. There's something called Min Choices Revision that's coming early this fall, and all of our care coordinators are going to have to become Min Choices certified, and it's going to take a lot longer for them to do their assessments. We're talking probably 2 or 3 additional hours per assessment. That's going to be very timely. It's going to take a lot more staff and resources to keep our caseloads at an appropriate level. There's something else called Waiver Reimagine coming down the pipeline, also something called Case Management Redesign, along with the uncertainty of the next procurement. So a couple years ago, we really thought that the next procurement was coming. That has since been delayed. The state has made a flip-flop to let the metro counties procure before us in outer state Minnesota. So we're not even looking at the next procurement to take place until 2022 with an implementation 2023. So we're a long ways out from that. And I really think the main message for today is we are seeing increasing demands and needs across this area. We really are a resource-rich hub for individuals moving to our county. We have a great health system. We have great services that are able to be provided in our county. So I just wanted to point out some data regarding caseloads. So right now, currently, our Blue Cross Blue Shield care coordinators are averaging anywhere around 70s for a caseload. Really, Blue Cross Blue Shield wants those caseloads around 50. So we are at a need right now for added staff because the caseloads are too high. And I think even just the projection of that coming down the pipeline, and then in the fall with Min Choices Revision coming, we could be needing to add staff every 6 months come this fall and into the next years, just with the amount of individuals moving in. Current data, just again for your reference, we just got our June enrollment and we're looking at about 43 new assessments. So 21 new referrals and then 22 reassessments. So again, a lot of needed personnel to support this. The caseload data for our nursing home population, you can see that this has started to trend a decline. A large portion of that maybe has to do with COVID. There were a lot of deaths that happened in our county, and a large majority of those individuals might have resided in the nursing home. So we really are looking at a decrease. However, when COVID now is starting to go away, there's probably going to be an increase. We don't know what that's going to look like with individuals coming into the nursing home and not having COVID be a huge threat anymore to this population. So we started having conversations with Blue Cross Blue Shield. We reached out to them and said, you know, here we are at a capacity for our staff. What can you do to partner with us so we could continue this contract, continue to do this work, however, not adding and adding and adding more staff? Really, they didn't have any viable options for us. There's different program systems that they couldn't take this on. They couldn't cap the number of referrals that are coming to our county. Likely some of the recommendations that they gave us would be kind of short fixes where we're looking at more long-term planning for the overall agency. So options to consider, and again, why I'm here today having these conversations is, one, really, we could keep the Blue Cross Blue Shield contract. However, we really need to add staff. I'm looking at needing to add staff from both this group, so adding care coordinators for Blue Cross Blue Shield, and then coming with waiver reimagine and min choices revision and some of those things that are coming down the pipeline. We still have a need to add staff in our min choices area and also our waiver services area because they're all kind of interconnected. And when we look at adding more staff, I am administratively at a capacity where we would need to look at adding another layer of supervision. I have some supervisors in the agency that are overseeing 19 direct reports, 17 direct reports. That's very unhealthy. I think statistics kind of show that a supervisor really should be 8 to 10 to be able to efficiently manage and supervise their personnel. So when you start adding, again, layers of staff, layers of supervision, it gets very costly. Overall, our Blue Cross Blue Shield contract has paid very well. It's been lucrative for us to maintain the staff, and the staff have supported that. However, when you start to add in the extra layers, it becomes pretty much unviable. So the second option would be to terminate the contract with Blue Cross Blue Shield, and we would be at a capacity in the agency to reassign all of these staff and have 0 layoffs because of the added needs that we have in our min choices and waiver services areas. Again, those are mandated for the county to support. So we could in turn take these staff and reassign them to like positions. So if we keep the contract, like I mentioned, we would need to invest in our personnel. Again, I just want to point out that it's not adding staff and adding supervisors. It's then the IT time that it takes with having more personnel, the HR time, it's equipment that we have to purchase, and finding space for these staff. I would invite any of you down to take a look at our office space, but we are at max capacity for the number of personnel and the number of cubicles that we have in our office. Again, we look at our overall health and human services needs, looking past 2022 and beyond. And as I'm looking at increases in our mandated services, again, we could repurpose staff and have them assist in min choices, waivers, and other areas within the agency. You know, the future unknowns of what's going to happen with the state and DHS changes, and even procurement for that matter, really we could repurpose these staff and it would offer us quite a bit of flexibility for the agency down the pipeline. One thing with keeping the contract, our staff have done a tremendous job at building relationships with these clients and subscribers. We've really done a great job with our quality. We have audits and we pass with flying colors all the time. Blue Cross Blue Shield has been very complimentary of the work that our staff have done. So I really want to say that I know that there might be some questions about what that looks like if we at the county didn't continue that work on behalf of Blue Cross Blue Shield. So if we would terminate the contract, Blue Cross Blue Shield requires a 130-day written notice. Again, we have capacity within the agency to repurpose all of these staff and have no layoffs if we make that decision now. It offers us the flexibility. If something comes down the pipeline that makes a tremendous change with billing, how we're getting paid for these services, we wouldn't be at a standpoint in 6 months or a year from now coming to you and saying, okay, our contract now, the payment structure has changed and we need to make the decision. And at that time, we could be laying off staff. The other thing is when you start to increase and kind of inflate staff, who knows where some of these changes might go, and if some of these areas shrink, again, we would maybe be at a point that we've added 6 staff and a supervisor, and then in 2 years, I'm coming back and we're having to do layoffs at that time, just because there are so many unknowns with DHS and some changes that are coming. There is the potential, again, we can reassign these staff to like positions, but we would maybe see some upfront lost revenue for this next year. Again, Blue Cross Blue Shield has paid us by every 15-minute unit. That's been very lucrative. We do get paid in our other areas, but it's not the same payment structure. So there would be maybe some loss of revenue that we would see for this next year.
I've got a couple of questions.
Let's let her, I think she's almost ready to wrap
Yeah.
up.
So again, where do we want to go? What is our true mission, vision, and values? We as the county are here to support our community. We're supposed to protect our vulnerable populations, really be that safety net. So again, I think that we've got some options. However, it just depends on what the county board would like to do. Again, adding a lot of resources and staff, and we certainly can do that. One thing I do want to point out with adding resources and staff, you guys are all aware it's sometimes hard to attract staff. So when we're trying to look for 5+ staff to support this area next year and a supervisor, who knows what other kind of management would be needed, I do get fearful that it might be kind of hard to fill some of these positions. It's been hard across not just Health and Human Services, the entire county, and you can see help wanted signs everywhere. So that is just one other thing I would like to point out. But I really think that right now, going into budget season, we want to make this decision before the Min Choices revision happens, which again is in early fall, because we don't want to have a lot of time, resources, and investment spent on training if we're not going to fulfill and continue this contract, because it will look different for these staff.
Thank you. And before we open for questions, I have a couple of questions, and I want to see if Administrator Kleindall has any comments he wants to add. But you said Blue Cross Blue Shield needs an answer by fall. What is your timeline for making a decision, and are you going to bring a recommendation to us? You can answer, or we can let Larry talk first if Larry has anything to add, and then we'll.
Yep, I can take that. Okay. So we really need to give them the 130-day notice, and we want that to take place so the 130 days are done before November 1st, which is that launch date. So I'm looking at really needing a strong decision made by the next board meeting. At the end, latest would be, like that 20-something of June is what we're looking at.
Okay.
So relatively soon. Yep. And I would say, from my standpoint, I'm bringing you 2 options for you to ultimately make the decision as a board. Again, I think from our agency standpoint and knowing what's coming down the pipeline, I fear not making a recommendation right now to necessarily terminate the contract. We could potentially be in a worse situation, and I would hate to see staff layoffs. And I think that's really why I'm bringing it forward to today, is because we do have capacity within the agency, and we need to hire on more staff. And maybe instead of hiring on externally, we would repurpose these staff and be able to maintain our staffing levels.
Thank you, Larry.
Well, as you probably are aware, this is not the first time Jenny and I have talked about this. Over the past several months, Jenny has brought this to my attention, saying that this is a potential issue. I've asked Jenny and her staff to work with Blue Cross Blue Shield to see if there's any options. We've been trying to see if they would move or support us, assist us in some way. And at this point, they're saying they're not capable of doing that. And so we're bringing this to you now so you have a little time to think about it. This is a big decision. So we won't make a decision on this until the next board meeting. If you don't make the decision at the next board meeting, what could possibly happen or will happen is that the notice won't go in time, and then we'll have resources going for staff training on a program that we're no longer going to be continuing. So it doesn't make sense to get staff trained and then discontinue the program. So this is a big decision. We have been talking about it quite a bit, looking at the numbers, trying to figure out a way to make it work, and going back and looking at our work session from 2018. It was discussed at that work session, if this ever became a situation where it wasn't workable for the county, then we should not be doing this program. And that's where we're at.
Thank you. Commissioner Nissen.
I have a couple of questions. Staff-wise, you mentioned, first of all, we have 5 staff with 1 vacancy, but they're not county employees, yet you refer to them as being repurposed, or are they different people?
Nope. So the staff that are doing this Blue Cross Blue Shield care coordination, they are our county employees, but they're just working on behalf of this contract. So they're working on behalf of Blue Cross Blue Shield.
Okay, so they are.
So they are our current Candia County employees, yes. So what I was referring to is we have capacity in our other mandated service areas, min choices and waivered services, to be able to take those staff and repurpose them into like positions within the agency.
Okay, so we have some people that could transition into this if we were to terminate the contract. These people would stay here,
They would stay here as Candia County employees, yes.
and they've been doing the similar kinds of work.
Correct.
Okay, and then does Prime West Health offer care coordination?
Yes, so that is one of the uncertainties, is if procurement happens and we do get Prime West, that could be something that then we're looking at, again, shifting internal staff, or we would have to hire staff on at that time and relook at doing the care coordination.
If you could tell us where Prime Health is, Prime West Health is going to be at, that
Get her
would
done.
make it
Well,
a lot
they're in the
easier.
same boat as you, she mentioned procurement, and that's the ugly bird that's flying overhead, and we don't know where that's going to drop. But I will put on my crystal ball at home and warm it up really good.
Thank you.
Commissioner Gardner.
Thank you, Mr. Chair. Jenny, can I presume that these additional mandates by DHS are not accompanied by additional funding from the state?
Probably looking at different funding, that we might get paid differently than we are now. Some of the waivered services, they're talking about being paid differently. So some areas we might see increases, some areas we might see decreases. There's just a lot of unknowns. But I mean, to answer your question specifically, yes. I mean, likely when state mandates come, we don't get an increase in what we're seeing.
If anything, you're probably looking the other direction.
Yeah, could be. Yep, and I think that that's one of the concerns with just this contract in general. We don't have the leverage to decide how this is going to get paid. So yes, right now in this current time, it is lucrative. However, in 6 months, 3 months, a year from now, we could be at a really tough position if this contract pays differently, which there is a likelihood of that happening. And then I would hate to have us at that time looking at doing 6 layoffs.
And we aren't being allowed to engage in a procurement process at this time. So it really leaves, well, really all of outstate Minnesota counties in limbo. And I'll make the comment, it seems like in this area, DHS is saying drop dead.
So, and notice the time is creeping away on us. Commissioner Berg.
There's a couple of comments. Your choices or options are I'm not sure we have much of a choice or option when you look at it. And I really appreciate you bringing this forward to us. I really want to point out, I always felt very positive about Blue Cross Blue Shield, and we've always have had a good working relationship with them. And I don't think this is necessarily a reflection of that, but where do we want to go with this? And I personally don't see that we are in a position with everything that's going on in this budget time and so forth to be adding a lot of staff. And it's not too often that we don't have choices not to add staff because they're mandated services. This is one choice we have. And if we can come up with a plan and they're going to be responsible and the services are still going to be provided, it makes sense. And I've also been hearing about the needs in your department for additional staff in other areas and not wanting to add new staff there as well. And this looks like kind of a win-win situation in that this being budget time, we're not going to lose the staff, but we're going to lose some revenue. And that's one question I did have. Any feeling how much revenue? Because when you reassign staff, they can produce some revenue possibly where you reassign them.
Yeah, yep. So again, it depends on which areas. We don't have this all mapped out. So once the decision would be made by the board, if we would terminate the contract, then we would look at what other areas. And then at that time, we would be able to know, okay, if they go to Min Choices, they'll generate this much revenue versus going into waived services. So there's still a lot of unknowns with that, but I know that there is the potential of them not generating the same type of revenue that they're making right now.
If may, one more quick question. And we understand the staff is also on board with this possibility of going this direction.
We did meet with the staff last week, and we gave them just a heads up that we would be presenting this at county board and that we've been taking a look at it. I know that they're feeling burned out, so I think any type of relief for them in doing their roles would be appreciated. But I know that they do have concerns about it. I think that they've built very strong relationships with these individuals. They're worried about who's going to take that on. Will it be to the same level of the integrity and everything that they're doing day in and day out with these clients? So I do know that the staff are concerned about this, but they also, I think, are realistic to see that they can't continue doing the work that they're doing in this current situation. They need a supervisor that doesn't have 19 other people that they're overseeing, so they have some additional support from a supervisor. They need additional staff. So, but yes, the staff are concerned.
Okay, thank you.
Larry?
Well, I was just going to say, with the question that Corky was asking, we did meet with staff. Of course, if they had the druthers that they'd like us to keep doing this. But when it comes right down to it, and I had talked to Jenny about this, I said, what is our mission? Is our mission to chase the dollar? Or is our mission to provide services to the vulnerable people? And these aren't easy decisions. We would, if a perfect world, we would have our staff continue doing the jobs that they love. But we're probably at a point we have to make some adjustments. And our staff, as much as they love what they're doing, the like jobs that we would transfer them to, they would make those adjustments and they'll be okay. Again, we want to let our staff know before we came here so they didn't hear it from watching on TV. We want them to understand that this is a process. It's not an easy process, one that we do not take lightly. And we don't take this to the county board lightly about the change in revenue that we're possibly going to face, but we also know what the long-term consequences are, and that's what we have to bring before you sometimes. If we do this, here's what could happen.
Thank you. And I know we need to actually go, who would do those services if we can't come to an agreement with Blue Cross Blue Shield for more revenue?
So Blue Cross Blue Shield would find an outside agency to do those services. That could be a nonprofit. I know Lutheran Social Services does that for one of the other MCOs. So I mean, there's some options, but that would be totally on Blue Cross Blue Shield. And I don't know if they would reach back out to us. If we give a formal notice, if they do something that way, I don't know. But I just know that in our conversations, asking about how can we help with our current situation and not keep inflating, they've really said that there's no options and they would just take this and find a different entity to provide this service.
So, board members, we have a lot to think about over the next 2 weeks or whenever, 2 weeks when our next meeting is. And so if you have any questions, be sure to reach out to Jenny or to Mr. Kleindl and be ready for a decision at our next meeting. With that, I have to give us a break before we start our next meeting, so I'm going to adjourn this. Thank you, Jenny, for the update.